So trigger point dry needling for medial shin pain. So I mentioned before, 4 muscles, the deep toe flexors we're looking at first. First one will be the Popliteus, then we come down and we've got tib post, flexor dig, and then obviously we can come down here and hit the medial soleus as well. So these are the ones that we're going to focus on. Now, in order to needle these areas, the deep compartment, this is so important. It is the edge of the tibia that we want to find. That's our bony landmark that is so important, because we're going to needle up against that and then down. So the idea is that we will hit the tib post, the flexor dig and so forth, but it's the trigger points that we're after in those areas here. Now, in order for us to find Popliteus, come down to the, basically we're going to be looking at the femoral condyle, or the tibia condyle here, sorry. So we're going to find that condyle, we're going to roll down, mark the bottom of it there, roll in, and it's probably about 1 or 2 finger widths in from there, and it's right behind the tibia. So it'll be right in that area. Now, why Popliteus is so important, it unlocks the knee when we stride. We've mentioned this a little bit before when we talk about lower limb injuries. So very highly important, and as I said, in terms of medial shin pain, it is really important because it allows that knee to get into full extension. So that's the first trigger point right through there. Second one, we're going to come down a little bit further, a little bit more distal, and then we're going to pick up the tib post, which is about here. Okay, once again, right at the back of the tibia itself. And then we come down a little bit further from there, maybe another finger width down there, and then we've got the Flexor Digitorum Longus. Okay, come all the way down here, and then we'll hit the Medial Soleus as well. And that can actually refer pain into the foot and into the Achilles. So let's make a start. We know where our trigger points are. We're going to use our 50s again. So once again, as I've mentioned before, it is so important that you palpate, find the trigger point, spread where you're going to be. I'm up against the tibia. Using the guide, place it in, and then I'm just going to come right next to that tibia. Boop, right through there, and that's it there. Okay. Now, the reason we come in from the side and we don't go this way is to avoid any of the nerves or the neurovascular bunch. Okay, so I'm going to come down and hit that tib post now, which is down a little bit further. So once again, angle the needle towards the tibia, hit the edge of it, and then you're in. Push down. Second one, we're going to come down, it's going to be the Flexor Digitorum Longus, which I love saying, which is just about there. So once again, it's just a tad distal, trigger point wise. Same approach, angling in. And then the last one will be the soleus and the medial portion of soleus. So you'll feel it's a lot more bulkier. And we have a trigger point right about there. Now, remember sometimes these trigger points can be very powerful. So it's really important that you check in with your clients just to see how they're feeling. There's a really strong Popliteus there. Okay, so once again, tibia condyle, come down, which is roughly around about here. We're about 2 finger widths in, posterior to the tibia, needle in. Same with tib post, so go down, roll off the tibia, palpate deep. So you're going to be pushing the gastro out of the way. Once again, the same with flexor dig and then the soleus. Okay, we're going to check these on 3-minute intervals. Okay, if there's still strong referral or really strong dull aching pain, then leave them for another 2 minutes and then check them intermittently about every 2 minutes. So you can leave these in anywhere to 10, 15, maybe even 20 minutes sometimes. All right, so that's needling for the medial compartment for shin splints.